live session of our 90 Days University Prof Pre-Final Mastery. So today our topic of discussion will be the practical ophthalmology part 2. So today we'll be discussing about the rest of the topics other than we have discussed yesterday. Okay. So mainly we are going to discuss about the viral infections of our eye, and we'll discuss about its management and the differences between the direct and indirect ophthalmoscopy. We'll discuss about the retinoscopy. Okay, we'll discuss about iridotomy and also the differential diagnosis of nodules near the limbus. And in the short questions, we'll discuss about the gonioscopy and the pinhole test. Okay. So these are the practical aspects of the ophthalmology, and these questions in in your theory exams have been repeatedly asked in your previous year questions. Okay, so these practical aspects are also asked in your theory questions, so you have to be prepared for theory answers for these topics. Okay, so before starting of our lecture, I would like to give you a brief introduction of what is Auricle and why you should choose Auricle. So we have recorded classes, we have live classes, we have practical sessions, exam modules, and the hard copy book set. Okay, so these recorded classes, it offers you the freedom to choose from the multiple educators for each subject, and it provides you flexible learning with over 10 years of experience from the educators, and it caters specifically for your MBBS prof exams and also your other entrance exam, PG entrance exam. Okay, and these recorded classes is also convenient for you to revise in your last exam time. Okay. Okay. Other than that, we have live classes. In the live classes like this one, we have 45 days live class series where every important topic is covered. In-depth coverage of the topics are covered, mainly focusing on the past 10 years previous year questions and also the most important or most anticipated questions that would come this year. Okay. In these live classes, there are also MCQ polls and live doubt clearance. You can clear your doubt at that time with your tutor. Express exam modules. These examination module is specifically designed for you or is specifically made for you in a very crisp and concise manner so that it becomes easy for you to read and to remember those concepts and your answers. And the entire syllabus, sorry, this express exam module is made to cover your entire syllabus in under 20 hours with strong emphasis on your answer writing skills. Okay, and these are also the interactive sessions like live classes, and you can complete those most important topics in under 20 hours for your exams. Okay. We also have one-to-one doubts clearing session. So these doubt clearing session, you can ask from any from your respective educators if you have any doubt, and this helps us to create a very safe learning environment for our students. Okay, so as I was talking about, so this is the hard copy note set. So these notes are made for you in a very crisp and concise manner so that it becomes easier for you to retain and to remember or to read the concepts. Okay, and it avoids the reading of every line of the textbooks. Okay, which is not very feasible. So these notes contains every topic, and this also includes past 10 years previous year question and the most anticipated questions. Okay, and this also has beautiful colorful diagrams. Okay, that can be drawn by you in your exams. Okay. Other than that, we have question banks for practice sessions. So these question banks covers MCQs for your prof exams, for your NEET PG, or for your FMG exams. And these are customizable question bank for your better exam readiness. And it has the 3 levels from beginner to expert level, okay, of questions. Okay, lastly, we have the practical sessions. So these Auricle's practicals classes, it is very important because practicals are not to be missed and they're very important part of the curriculum. And it almost contains the equal weightage of your marks in your prof exams. So these practical sessions provide you hands-on experience and understanding of everything that is required in your practicals. And it also guide you through the Viva post questions, and it helps you gain the confidence and the skill which is needed in your practical exams. Okay. So we have four kinds of subscription plans. That is foundation plan, advanced learning plan, complete learning plan, and ultimate MBBS plan. So these four plans are according to the duration of the validity. So we have 3 months, 6 months, 12 months, that is 1 year, or for the whole MBBS, that is 4 years. Okay, for all the 4 years. So you can go opt for any plan according to your needs. And you can use my coupon code also if you want an additional discount on that. Okay. So let us start our main lecture, that is practical ophthalmology part 2. So we are going to discuss about the practical aspects of ophthalmology. Yesterday we discussed about the half of the practical things. Okay, so today we are going to discuss about the rest half of the things. So first of all, we are going to discuss about the viral infections of the eye. This is not about the practical, this is not exactly about the practical aspect, but we are going to discuss under this heading because the questions from these viral infections has been repeatedly asked. So we will just discuss about this thing. Okay. So introduction to the viral infections of the eye. So common viral pathogens which affect our eye includes herpes simplex virus, varicella zoster virus, adenoviruses, cytomegalovirus, Epstein-Barr virus, HIV, and the modes of transmission of this virus includes direct contact, droplet spread, and blood-borne. Okay, so these are the mode of the transmission. So these viruses, the list that I just read to you now, this list is contains almost every virus which is known to affect human beings. Okay, so these viruses like HSV, VZV, adenovirus, CMV, EBV, and HIV, these are very lethal viruses. Okay, so if they cause infections in your eye, okay, if for example, herpes simplex virus does not cause infection only in your eyes. Okay, it may be including, it may be affecting other organs or other body parts of your body. Okay, so it can affect more than one organ. So that is the main viral infection impact is. So the common viral pathogens include herpes simplex virus, varicella zoster virus, adenovirus, cytomegalovirus, Epstein-Barr virus, and the human immunodeficiency virus. So these are the 7 viruses, which is very important and which cause viral infections in your eyes. Okay. Now, what are the mode of transmission? How does this viral infection happens or occurs in our eyes? Okay. So it can be direct contact with the eyes, or it can be droplet spread, or it can be bloodborne. Bloodborne means if you have any viral infection in your other organs, so the virus can spread through the blood vessels, and the blood vessels supply the blood to the whole of the body. We know that. So it can cause infection to our eyes as well. Okay, so that is bloodborne or hematogenous route. Okay. So that is the mode of transmission is direct blood. This is the transmission. Okay, transmission of the viral infection. So if the infection, it, so yes, it is very easy to remember keratitis and conjunctivitis in the anterior segment because of the presence of cornea, conjunctiva on the anterior side of the eyeball, and the posterior side we have the retina, we have the choroid. Okay, so that is present in the posterior side. So retinitis and choroiditinitis can happen in the posterior segment infections. Now, what is HSV infections? So HSV infections, the clinical features of herpes simplex virus infection includes keratitis. Okay, in the keratitis, you can have dendritic ulcers on the cornea, or you can have geographic ulcers in the cornea. For example, this is your cornea. Okay, this is your cornea, this is your pupil. For example, this is your pupil, this is your cornea. So if I and this is geographical. So geographical means some kind of geographical map, okay, like this, and dendrites. So if you have seen any axon, so axon is like this, okay, and dendrites are like this. Okay, so dendritic ulcer is like this. So this is dendritic ulcer, like dendrites. Okay, so this is dendritic ulcer. So in the keratitis, so as a part of keratitis, you can have dendritic ulcer or the geographic ulcer. Other than that, you have blepharitis, that is inflammation of the eyelid. You can have vesicles on the eyelid, or you can have uveitis, which is granulomatous uveitis, or inflammation of the uveal tract. So uveitis means inflammation of the uveal tract. So granulomatous uveitis can occur, blepharitis can occur, or the keratitis can also occur. So these are the clinical features for the HSV virus. How do you manage? So since it is a viral condition, obviously you will give the antiviral therapy. So in the antiviral therapy, you can give topical acyclovir 3% ointment or the genciclovir 0.15% gel. Okay, 0.15% gel. So this is genciclovir and this is acyclovir. So acyclovir 3% ointment or genciclovir 0.15% gel. This is the first management. Second management is systemic. Systemic antivirals for severe cases. Oral acyclovir is one of them. Avoid steroids unless combined with antivirals. Okay. Avoid steroids unless combined with antivirals. Now, varicella zoster virus infection. So, this infection, the clinical features includes herpes zoster ophthalmicus. So, the particular ophthalmological disorder caused by this varicella zoster virus is herpes zoster ophthalmicus (HZO). This is a vesicular rash in B1 dermatome. So, B1 dermatome is a specific dermatome. So, we have many dermatomes throughout our body. So, specifically on the B1 dermatome, there's a vesicular rash present. Okay, so that is the clinical manifestation or the systemic manifestation of the varicella zoster virus. Okay, other than that, you can have conjunctivitis, keratitis, or uveitis. Conjunctivitis, keratitis, or uveitis. Management includes oral antivirals like acyclovir, valacyclovir, or famciclovir. Okay, famciclovir, acyclovir, or valacyclovir. These are the three antivirals used to treat the varicella zoster infection. Most common of them is the acyclovir. This is the most common used. Okay, topical lubricants for keratitis. Since keratitis causes dry cornea, okay, so keratitis causes the cornea to become infected, and the cornea is the part of our eye which is exposed to the external environment. Okay, so if there is an infection in the cornea, it can become more, the infection can exacerbate. Okay, so to control the infection, you have to give topical lubricants so the infection does not exacerbate or does not exaggerate, right? So topical lubricants has a role in controlling the infection. Corticosteroids for inflammation with caution, because corticosteroids has side effects also. It has side effects, so therefore used cautiously. Okay. Therefore used cautiously. So this was about the varicella zoster virus infection. Now adenovirus infection. So adenovirus causes, in the right hand side, you can see the diagram. It causes infection mainly in the conjunctiva part. It can cause conjunctival congestion, okay, or conjunctivitis. So the clinical features include epidemic keratoconjunctivitis, okay, epidemic keratoconjunctivitis, follicular conjunctivitis, and punctate keratitis. So it causes punctate keratitis and follicular conjunctivitis. You can see there are follicles present on the conjunctiva. So these are the follicles, okay, red one. These are the follicles. These are the follicles, right? This is the follicles. And punctate conjunctivitis, sorry, punctate keratitis means there are punctate lesions on the cornea. There are punctate lesions means the punctures. Okay, there are punctate lesions on the cornea. We have pharyngoconjunctival fever also, where fever is present. Along with that, sore throat and bilateral conjunctivitis. So pharyngo means sore throat, conjunctival means conjunctivitis, and fever means fever. So we have sore throat, we have conjunctivitis, and we have fever. So the name itself tells us. So pharyngoconjunctival fever. So just don't confuse with this name, pharyngoconjunctival fever. So in the name itself, this is a sore throat, because sore throat is mainly due to the pharynx infection, conjunctivitis, fever. So there's sore throat, there's conjunctivitis, and there is fever. Okay. So we've discussed the adenovirus clinical features. Now, what are the types of adenovirus? So mostly type 8, 19, and 37. 8, 19, and 37. So these are the most important types of adenovirus which cause this infection in the eyes. Okay, you can see here also group D human adenovirus, mostly 8, 19, and 37. Okay, so these three types is the most common cause of infection in the eyes. Okay, now management part. So management part, supportive therapy, cold compress and artificial tears, topical antibiotics for secondary infection you can give, or other than that, strict hygiene to prevent the spread. Because whenever there's an infection, you should always maintain hygiene to control the spread of the infection to other organisms, okay, or other human beings. So there can be supportive therapy, cold compress, and artificial tears, topical antibiotics for secondary infection. If there's secondary infection, you should give the topical antibiotics, and you should also maintain the strict hygiene to prevent it spread to other organs or to the other human beings. Now, CMV retinitis. So CMV retinitis, cytomegalovirus. Always remember whenever you hear the term or whenever you hear the name of this virus, cytomegalovirus. Okay, it has always it has always something to do with decreased immunity. Always remember this. Okay, always remember. For example, in your HIV, for example, if you acquire AIDS, okay, the full form of AIDS is acquired immunodeficiency syndrome. So it is acquired disease where there is immunodeficiency of the patient. Okay, so the patient becomes immunocompromised. So if there is decreased immunity, so the most important virus other than HIV, the most important virus that can cause secondary infection in AIDS patient is the cytomegalovirus or the CMV virus, because CMV virus is most commonly seen in the immunocompromised patients. Okay, so CMV retinitis is seen in immunocompromised patients. Example, AIDS. Okay, always remember cytomegalovirus means decreased immunity. Clinical features include floaters, scotomas, and vision loss. They can be retinal lesions, for example, hemorrhages and exudates, which gives a pizza pie appearance. Okay, pizza pie appearance. Uh, it is not visible in this diagram, but the pizza pie appearance is like this. For example, this is your fundus, and here is your optic disc. This is your optic disc. Okay, so pizza pie appearance is something like this. So this is a pizza. This is a slice of pizza, and it has pie appearance. Okay, so like this. So it somewhat look like this. Okay, so there are hemorrhages present over here, hemorrhages and exudates. So hemorrhages is with red color, exudates is with yellow color. Okay, so that gives a pizza pie appearance of the in the fundus. Okay, in the fundus picture. So there can be pizza pie appearance in the CMV retinitis. There can be floaters, scotomas, vision loss, hemorrhages, and exudates. Okay, so these are the clinical features, and it is most commonly seen in the immunocompromised patients like that of AIDS. How do you manage this condition? Systemic antivirals, ganciclovir and foscarnet, intravitreal injections of ganciclovir. So the most important antiviral in the CMV retinitis is the ganciclovir. Okay, ganciclovir is the most important antiviral in the case of CMV. Now, that was about the viral infection. So we have discussed at least 4 types of viral infections in detail. So whenever you get a question of viral infections of eyes as your long question, okay, if the viral infection of your eye comes as a long question, you know what virus you need to explain. Okay. So now we'll discuss about the ophthalmoscopy. So ophthalmoscopy are of 2 types, direct and indirect ophthalmoscopy. Okay. So the direct ophthalmoscopy, it is the one that produces an upright image of approximately 15 times the magnification. Okay, it produces the image of approximately 15 times magnified. So whenever you examine the patient eyes with the direct ophthalmoscopy, it magnifies 15 times. Okay, it magnifies 15 times. So 15 times bigger image is seen with the help of ophthalmoscope. And the indirect ophthalmoscopy is the one that produces an inverted, reversed, or direct image of 2 to 5 times magnification. So this produce 2 to 5 times magnification, and in a direct produce 15 times magnification. So just remember this thing, it's very important. Now, the condensing lens is not required in direct and is required in indirect. Examination distance is as close to the patient's eye as possible. And in the indirect ophthalmoscopy, you have to be at an arm's length. So this is an arm's length. Okay, so you have to be away from the patient by at least an arm's length. And the image formed is virtual and erect in the direct ophthalmoscopy. We saw here there's upright image, which is a direct and erect image in the case of direct. And in the indirect, we have real and inverted image. Illumination is not as bright, not useful in hazy media. Okay. It is bright and useful for hazy media. The indirect ophthalmoscopy is bright and useful for hazy media. For example, if you are having any corneal haziness, then you should use indirect ophthalmoscopy. Okay. Direct ophthalmoscopy has no use in hazy media. Okay. Area of field in focus, about 2 disc diameters is visible in the direct, and indirect about 8 disc diameters. Why only 2 disc diameters are visible in direct? Because in the direct we are magnifying uh, so huge magnification is present in direct ophthalmoscopy. So only a small part of the eye we can see, because it is magnified so much. It is so much magnified that we can only see the small part of the uh, fundus, you can say, or the optic disc. Okay, we can only see the only small part of the optic disc. And in the indirect ophthalmoscopy, it produces only the 2 to 5 times magnification. It does not produce as much magnification as that of direct ophthalmoscopy. Okay, so only the so here we have the area of field is quite more. Okay, like 8 disc diameters, or you can say 8 DD. 8 DD. So that this 8 disc diameters means the area of field in focus is quite large. Okay, so that is the case in the direct and indirect. So stereopsis is absent and present in the absent in direct and present in indirect. Examination through hazy media, I told you, not possible in direct, possible in indirect. Okay. So this is the difference between the direct and indirect ophthalmoscopy. Many times asked in your theory exams, it as well as it can be asked in your practical exams also. So it is a very important topic. You should not afford to miss this. Okay, you have to learn this topic. Other than that, we have retinoscopy. So retinoscopy is the name itself suggests that it is used to examine your retina. Okay. So objective method to determine the refractive error. So it is used to determine the refractive error by observing the movement of light reflected from the retina. Okay. So it focuses on the retina and it determines the refractive error by observing the movement of the light. So it observes the movement of the light which is reflecting from the which is reflecting from the retina. So it the light which is reflecting from the retina, it is observed by this retinoscopy, and it determines how much light is reflected. Okay, and by that it can determine the refractive error of the patient. So that is the definition of retinoscopy. Now on what principle does it work? It is based on the optical reflex. So light is projected onto the retina and its reflection is observed through the retinoscope. The movement of the reflected light indicates refractive status, right? So types include static and dynamic retinoscopy. So we have 2 types of retinoscopy, static and dynamic retinoscopy. Okay. Now, this was about the retinoscopy, and you should know only a small detail about it. Okay, not much detail into the retinoscopy. So definition, principle, 2 to 3 lines, and the types, that is static and dynamic retinoscopy. It is more than sufficient. Now we'll discuss about the iridotomy. So what is iridotomy? Tomy means making an incision or making any hole. Okay, so iridotomy means making a hole in the iris. So it is a laser procedure. It is a laser procedure to create a hole in the peripheral iris to improve the aqueous output. Right? It is a laser procedure to create a hole in the peripheral iris to improve the aqueous outflow. If we are improving the aqueous outflow, that means we are treating glaucoma. We are treating glaucoma and we are reducing the IOP. Okay, we are reducing the IOP. So what are the indications of iridotomy? Primary angle closure glaucoma can be one indication. Other than that, we have plateau iris syndrome. Plateau iris syndrome means the iris has become very rigid, okay, and very resistant. Okay, so it is not allowing the drainage of the aqueous humor. So that is plateau iris syndrome, or we can also have primary angle closure glaucoma. And the types include laser iridotomy done using YAG laser or the argon laser. Okay, YAG laser or the argon laser. Contraindication complications include blurred vision, transient IOP spike, and hyphema. Blurred vision, transient IOP spike, and hyphema can be the complication of the laser iridotomy. iridotomy. You can see on the right hand side, this is the iris. Okay, this is the iris, and this is the black. The black point is the hole made in the iris. So that is laser iridotomy. So laser is passed and a hole is made so that the aqueous humor flows. So the aqueous humor from here flows through that hole and drained through the trabecular meshwork. It is drained through the trabecular meshwork. Okay, so that is about the iridotomy. We have discussed definition, indications, types, and the complications of the iridotomy. Now, what are the differential diagnosis of nodules near the limbus? Okay, so near the limbus, so limbus is this area. Okay, limbus is this area. This is the limbus. So, what are the differential diagnosis of nodules over the limbus? So, there can be phyrectanulosis. Okay, phyrectanulosis, small inflammatory nodules associated with TB or staph infection. Okay, if there is any nodules associated with TB or staph infection, then it is known as phyrectanulosis. Then you can have pinjicula. Okay, pinjicula, it is the yellowish raised lesion due to the UV exposure. Very important, UV exposure. This is a yellowish raised lesion due to the UV exposure. Episcleritis, localized non-granulomatous inflammation. Scleritis, deep painful inflammation of the sclera, or you can have foreign body granuloma, which is trauma induced. Okay, so you can have trauma induced granuloma, you can have episcleritis or scleritis, right? Or you can have pinjicula or phyrectanulosis. Okay, pinjicula is due to the UV radiation, phyrectanulosis is due to the TB or the staph infection, right? So these are the differential diagnosis of the nodules near the limbus. Now, what is gonioscopy? So, gonioscopy is another practical aspect to determine the eye disorders. So, it is used to examine the anterior chamber using gonio lens. So, this is the gonio lens. This is gonio lens, and we are examining the anterior chamber of the patient. So, angle structure seen. Okay, angle structure seen from posterior to anterior. So, from posterior to anterior, you can see ciliary body band, scleral spur, trabecular meshwork, and Schwab's line. So this is posterior to anterior. So from the posterior to the anterior, what are the structures that you can see? You can see the ciliary body band, scleral spur, trabecular meshwork, and Schwab's line. So you don't need to remember, you don't need to read about these things in detail. Just remember these are the structures seen from the posterior to the anterior side using the gonio lens. Okay, so the gonio lens works on the principle of some kind of prism principle, just like the prism works. Okay, bar prism. So gonioscopy also works similar to that principle. And the main is the structures which are seen in the gonioscopy. So from the posterior to anterior, you can see ciliary body band, you can see scleral spur, trabecular meshwork, and the Schwab's line. Okay, now the indications of gonioscopy includes diagnosing glaucoma, okay, or iridocorneal abnormalities, because we are just focusing on the iris part. So if there's any iridocorneal abnormalities, that can be easily determined using gonio lens, and you can also diagnose glaucoma using the gonio lens. Why? Because you're examining iris, and if there's defect in the iris, or if there is any defect in the aqueous outflow because of the infection of uveitis or iris, okay, or so iriditis. So if there's any infection related to the iris, okay, then there can be glaucoma. So we can also diagnose glaucoma with the help of gonio lens, okay, or gonioscopy. So this was about the gonioscopy. Now, pinhole test. So you must have seen this pinhole whenever you must have visited an ophthalmologist to get your power check. So this is known as a pinhole. Why is it known as a pinhole? Because it has a small hole in the between. See, there's a small hole in the between. Okay, a very pin-sized hole. Okay, so that's why it is known as pinhole test. So it is a diagnostic test to differentiate between the refractive error and the organic pathology. Okay, it's a diagnostic test to differentiate between the refractive error and organic pathology. So it eliminates the peripheral rays because all the black things are covered, or it only allows the light to enter from this pinhole. Okay, otherwise all the black covering part blocks the entry of the light. So it eliminates the peripheral rays, allowing only the central rays to focus on the retina. Improvement in vision suggests refractive error. Okay, so if you are making the patient, or you're making the patient read using the pinhole, And if the patient has already some power, okay, if the patient has already, for example, a power of -4, and using that pinhole, if the power is improving, that means the person has refractive error. And if there's no improvement, it indicates the organic pathology. Okay, it indicates the organic pathology. So it is a very important test, and it differentiates between the refractive error and the organic pathology, right? So this was about the pinhole test. And here comes the end of our discussion. So we have discussed the practical aspects today: the retinoscopy, ophthalmoscopy, gonioscopy, pinhole test. We have discussed in detail about the viral infections. So this was the short session about the practical aspects, and these are the only questions which can come in your exams. Okay, there are no questions other than this which can come in your exams. Okay, so the practical aspects is limited in the theory exams. Okay, so the practical theory questions are very limited, and we have discussed all of the possible questions that can come, or we have already discussed the previous 10 years questions. Okay, so this was all including the previous 10-year questions. So summarizing our today's session, so we have discussed about the overview of viral eye infections, direct and indirect ophthalmoscopy, retinoscopy, and iridotomy. Okay, we have also highlighted the differential diagnosis for limbal nodules and gonioscopy and the pinhole test, and also about the uh, ophthalmoscopy. Okay, so this was about the today's lecture, and this was the practical aspects. Okay, just know the key points related to the practical aspects. You just don't need to read every principle of every line of the principle for the working of this instruments. Okay, you don't need to remember that. You just remember the indications, contraindications, or 1 to 2 line the principle and the definition. Okay, so only in the short you have to read about the all the instruments. So thank you for watching. We'll meet again in our next slide class. Thank you so much. Okay, thank you.
Yes, sir. Thank you.